Well, hey, everybody, this is Robert, and welcome to Outbreak News Interviews. Now, there has been, suffice it to say, a surge of mucormycosis cases, also known as the black fungus, in the country of India. So why mucormycosis? Why in India? And how is it, if at all, linked to COVID-19? Well, joining me today to take a look at this topic is Judy Stone, MD. Dr. Stone is an infectious disease specialist and a senior contributor at Forbes. Dr. Stone, welcome back to the show. It's been a while.
Thanks so much for having me again. It's always educational.
Okay, great. Well, before we go ahead and take a look at the whys, like some of the questions I asked in the introduction, let's look at some of the whats, because mucormycosis is probably not on everybody's tongue around the country. So, Judy, Dr. Stone, what is mucor?
Mucor is a fungal disease, and it actually includes about 50 species that are common in soil and decaying plant material. It used to be called zygomycetes. You know, I've never seen a case of mucor in my whole 40 plus years of practice. So most places only see a handful at large institutions. This is quite dramatic and exciting if you're an infectious disease person.
Absolutely. How does someone contract this fungal infection?
We all inhale mucor from soil, compost, and in India perhaps from dung, and sometimes it causes skin wounds. But generally, it's by inhalation, and people who are immunocompromised are those who get it. In this country, it's almost exclusively in people who are diabetic or in people who have hematologic malignancies like leukemia or stem cell transplants. Occasionally, they're seeing some in patients with iron overload. But what puzzles me is that while we're seeing diabetes blamed for the surge in India, there's got to be more to it, because India doesn't really have more diabetes than other countries do.
Right. And this is not something that's person-to-person transmission at all, is it?
No, it's strictly by inhalation and bad luck.
So how common is mucormycosis, even pre-COVID, in India?
It's much more common. It's 70-fold times more common in India than the US. There are 14 cases per 100,000 pre-COVID in India. And now on May 25th, there were 11,700 cases reported as patients being care. And this week, there were 31,200. Wow. So it's really surging.
Sure is.
And they're doing remarkably well. They're doing remarkably well with it in terms of the death rate, actually. Much better than I would have expected, because normally there's about a 50% death rate.
Yeah, I was just going to ask you about that. What is the pathology that goes along with mucormycosis?
What we're seeing, it can be two forms. One is a pneumonia from inhaling the spores from the fungus. The other more common and dramatic one is a sinus and eye infection. And that's why you're seeing headlines now about people. Yesterday there were headlines about 3 kids having their eyes removed because of the infection. So it tends to start in sinuses and then involve the eye and require extensive surgery to keep people from dying from it. People think that what's going on is that the fungus invades the lining cells, the endothelial cells lining blood vessels, and that causes small clots and causes tissue death. And it's really not that the fungus is black, or the name black fungus. It's from the tissue death causing necrosis or black dead tissue. That's very deadly.
Yeah. Is it treatable? Is there a standard regimen to treat this?
There is, but you need to be wealthy enough to get that, and you need to have access to good medical care. So the mainstay of treatment is surgical removal of all the infected tissue. And people have to go back to the OR more than once. As the tissue death extends, tissue necrosis extends, they have to repeatedly debride that. Patients are also treated with amphotericin, which is a really toxic, nasty drug. Used to be called amphoterrible. And because it kills kidneys and causes horrible side effects, chills and blood pressure changes, and it just was nasty. There's another form of amphotericin called liposomal amphotericin. That costs $400 a day, and there are terrible shortages of it in India. And a lot of people in India earn less than $1 a day, so this is really an extraordinary expense for them. Two newer antifungals are isobuconazole and posaconazole are also being used, but they're not considered the drugs of choice. And all of these are in terrible shortages in India.
But is the regimen, if you do have the resources to get it, is it pretty effective?
Right. Well, your mortality reduces to maybe 20 to 30%. They're actually doing better than that at the moment, so they must be being very aggressive with the treatment and the surgery. But they're a little bit better. I had some email exchanges with some of the doctors in India, and they're saying that the amphotericin is a little more available than it was even just a couple of weeks ago. The government has been somewhat slow to respond.
Yeah. So let's go ahead and switch gears to what is actually happening in India today. What do we actually know about what's driving the spike in infections? Is it linked to COVID? And what don't we know?
It's really fascinating. I hate to have this sort of macabre interest and say that because, it's a horrible infection and very disfiguring if it doesn't kill you.
Right.
But it's the most intriguing puzzle I've seen in a long time. We don't know what's causing this because, say, India already had a baseline higher rate than other countries around. Who knows why? But the major hypothesis is that really high steroid use and inappropriate, not following guidelines steroid use is the major driver. There was a trial called the recovery trial, which showed that steroids were useful in reducing the death rate from COVID, but only in patients who were on oxygen or required mechanical ventilation, especially the latter group. But in India, it's being used indiscriminately. One of the intriguing things is that the mucor was not seen in the first wave of COVID in India. So what's different between the first wave and the second wave? So is the Delta variant causing something different? Is the widespread use of steroids worse now than it was early on? We just don't know. There are other hypotheses. One is that commonly prescribed in India are multiple drugs, which are generally worthless, but include azithromycin or doxycycline. And then when patients don't get better, they get broad-spectrum antibiotics. And anytime you do that, that fuels fungal overgrowth. So it's unclear whether that's a problem. We know that COVID damages beta cells that produce insulin, so there's a sudden increase in new diabetics and patients who were not diabetic before, and uncontrolled diabetes. And these are the patients who are getting mucor for the most part. And also, we've learned that COVID increases the amount of iron in the blood, and that can fuel mucor. But Dr. Kalantri and I have been emailing back and forth, and he's a leading doc there. And he pointed out that about a quarter of the patients, almost a quarter of the patients with mucor were not diabetic. 14% hadn't used steroids. So we're left with who knows. Again, one of the more interesting hypotheses, which has fueled some anger on Twitter anyway, is about people using cow dung and rubbing it on their skin. And that's common in rural parts of India. But again, that doesn't account for the change between the first wave and the second wave. So there's so much that we don't know about this that it's really intriguing.
Yeah, quite a mystery, right?
Right.
Dr. Stone, are we seeing similar situations in any other countries besides India?
Not to this magnitude.
Yeah.
We're seeing scattered cases of mucor elsewhere. There's some in Nepal. There were just some reported in Iran and Brazil. But they're isolated cases, nothing like this magnitude. One of the UK docs said he sees 4 to 5 cases a year normally, and they've not had an increase. So it's a mystery to me.
Yeah. So it could be linked to steroids or other predisposing conditions. Are there other fungal infections rising in India also?
Again, I haven't seen much published about that, but I asked some of my colleagues there, and Dr. Hegde, who's been very prominent on Twitter, he said that he's an eye doc, and he says he's seeing concurrent infections at the same time with Aspergillus and Candida, and that again goes along with heavy steroid use and uncontrolled diabetes. But he says it's fairly common to see both together.
You kind of alluded to earlier that the Indian government, the medical public health system, is dealing with this surge, this outbreak within an outbreak pretty well. Would you say that, or?
No, I wouldn't say that.
Oh, okay. I thought you alluded to that. All right.
No, they're dealing with it better than they did a couple of weeks ago.
Oh, gotcha. Okay.
They're not dealing with it well because they were dragging their feet. They stopped. I don't know whether at the moment they're reporting mucor cases, but a couple of weeks ago they had stopped reporting cases, which is interesting. Just, nobody wants, and there has been a tendency to downplay the amount of COVID that's there and downplay the amount of mucor. And in this case, they also were not recognizing or acknowledging the lack of amphotericin. So there were lots of questions about why aren't they importing it? Why aren't they moving more quickly on this? Why aren't the factories in India, which is a major drug producer, why aren't they ramping up to produce more amphotericin? So that's a little bit better than it was a couple of weeks ago, but is still not enough to meet the demand. And at least until before the past week, again, I apologize for not knowing if that's changed this week, but patients had to go to a government hospital to get amphotericin. And that's also really limiting. There aren't enough specialists. There aren't enough treatment centers and not enough drugs. But it's getting better. One of the most heartbreaking things is seeing as I look, search for mucor on Twitter, which is still one of the best sources of infectious disease news. Anywhere, that's where the action is. But it's heartbreaking to see all these people begging for drugs for their family members, and centers saying, "Okay, we received 300 vials of amphotericin this week, but that isn't enough for one patient, and we have 30 patients." So there's still a huge break. The government also came out, though, in saying this week that they would no longer tax amphotericin, which will still help some. But basically, it's extraordinarily expensive for people who live in such dire poverty. It's unattainable.
So where do you see this going?
a lot more deaths and disfigurement and blindness, and people being forced into poverty or using their life savings. There are stories about people selling their homes, which aren't worth that much anyway, but by their standards, selling everything to try to save their family members, and it's really heartbreaking.
It's very tragic.
Yeah, it's absolutely heartbreaking. And again, there haven't been enough. A lot of healthcare workers have died from COVID. They're burnt out. They're overwhelmed by the massive number of cases. So I don't see a happy outcome to this, and we are trying to work with some of the Indian colleagues to develop a registry so we can better learn what these risk factors are and find solutions. But again, everybody is overburdened.
Yeah, it's interesting. I was looking to do this podcast with this physician from India who did a paper some time ago about rabies survival. Mm-hmm. And I contacted him and he said, I need to put it off for at least a month. I have this COVID mucor crisis right now and I just don't have time. So, I mean, that kind of says it all. I mean, he's that tied up with this particular situation.
Right, and the people who I've reached out to have been very, very generous with their time in answering questions, both before and in trying to work with them on getting a registry going.
Yeah, well, for the audience, I encourage you to check out Dr. Judy Stone's article in Forbes, and I'll link to it in the show notes below so you can check it out for yourself. That's what caught my eye, and that's why I contacted Dr. Stone. And I want to thank you, Dr. Judy Stone, for sharing your knowledge about this situation in India. Appreciate it.
For having me, and if we find answers, perhaps we can talk again.
Absolutely. Thank you, ma'am.
Thank you again, Robert. Bye-bye.